Hello, my name is Colton, and this is my video response for the shadowing event for Nursing 540. I decided to shadow a respiratory therapist at Chandler. I was on the same floor as I did my clinicals, however, instead of the progressive side, I was on the ICU side. Um, Again, I shadowed a respiratory therapist, and mainly his routine was that he would go in, make his rounds about 9 o'clock in the morning, and he would go in and check on the patients, check on their ventilation efforts, check on their or not ventilation efforts, but the respiratory efforts. And 9 times out of 10 cases, they had a ventilator or some sort of ventilation device hooked up to them because of the ICU environment and them needing critical care that, in some cases, keep them alive. And so, what he did when he did make his rounds is he would, on every patient, regardless of the respiratory effort, would go ahead and suction the inside of the respirator. And in many cases, when they were doing this, they were very very low level of conscious. So that at the very most, they would have some reactive coughing, but it never really went beyond that. And then a couple of them, he had kind of like a nebulizing medicine that he was able to hook up to the device. And then you go ahead and also check like the moisture, the kind of like how you kind of hook up moisture to a nasal cannula. It's the same idea, except it's in a ventilator instead of a nasal cannula. Um, since it wasn't a nurse, it was very much a difference perspective wise, because he is kind of like a medical team or like a doctor would do. He would make his rounds, see his patients, do what he had to do, and then he would move on to the next one. It was never really prolonged care, and it's mainly because they, unlike nurses, there's like too few of them, so they can't really stay for a prolonged period of time and really take care of these people and what their needs are. That's not their jobs. So it was much kind of like doctor-esque, once you move from patient to patient to patient, and then you do what you need to do, check on their equipment, check on them, see if they need any interventions, any updates, and so on and so on. When it comes to interprofessional collaboration on the ICU side, I found it particularly interesting that the respiratory therapist would actually kind of time his rounds to where the medical teams, like the doctors and whatnot, would pair up and also do the rounds at the same time, and we would be present for their decisions and their plan of care per patient. So that was actually really interesting, and I think that's definitely kind of playing into interprofessional communication, because it takes two different professions and it combines them into one by them understanding that they both have an idea of what the current status of the patient is, what they need to be done, what needs to be improved, what's okay, and so on and so on. And so overall, I think it was a really good experience. I think I understand more of what respiratory therapists do, and how they're really, really important, especially in the ICU side where patient care is really, really critical, and many times they need these really high-tech equipments, which in some cases a nurse might not know how to operate and how to really gauge accurately, and that's where respiratory therapists come in, and they're very, very critical for these patients. Um, yeah, I thought it was very enjoyable, and I would definitely do it again. Thank you.